The top stories tonight and why news. COVID-19 testing czar Vince Dizon refutes an article published in a Singapore-based journal which says that the Philippines is the next potential COVID-19 epicenter in Southeast Asia.
The Bayanihan to Recover as One Act, or Bayanihan 2, passes on the second reading in the House of Representatives, while the Duterte administration expects the Congress to pass the bill next week.
Presidential AntiCorruption Commission to file charges against 36 PhilHealth officials before the Office of the Ombudsman next week. A lawmaker constructs free bike repair stations in Quezon City amid limited transportation operating during the modified enhanced community quarantine period in Metro Manila.
The economy in the United Kingdom faces a less severe downturn than feared.
When huge sporting events will resume is still uncertain, says the World Health Organization. Good evening, Philippines and the world. Today is Thursday, August 6, 2020. I am Harleen Delgado.
Join us in the next hour as we deliver today's top stories around the globe. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news, COVID-19 testing czar Vince Dizon refutes an article published in a Singapore-based journal which says that the Philippines is the next potential COVID-19 epicenter in Southeast Asia. To tell us why, our health correspondent Aiko Miguel will join us tonight live. Aiko, why did testing czar Dizon say there is no truth to that news?
Yes, Harleen, since Thursday last week, COVID-19 cases recorded daily in the Philippines number as high as more than 3,000. And today, the country has a total of close to 120,000 confirmed cases. Although this is the country's current situation, testing czar Vince Dizon believes that it's normal that cases upsurge, which could be attributed to the expanded testing capacity in the country. This is Dizon's response to a report released by a Singapore-based journal that the Philippines is next potential COVID-19 epicenter in Southeast Asia. Here's the statement of testing czar Dizon.
Speculative yun. Pero ang masasabi ko, dumami na ang testing natin. Tayo na ang pinakamataas sa Southeast Asia sa testing per day. Nasa halos 1.7 million ang natetest natin sa buong bansa. Mahigit 1 milyon na dyan ay nasa NCR lamang. At tuloy-tuloy natin gagawin to.
Harleen, Dizon adds COVID-19 cases also continuously increasing because of eased quarantine restrictions in the past month. In line with testing the government's strategies to search for the contacts of COVID-19 positives and have them immediately isolated. Dizon said that while testing continues, more and more positive results will come out. But that's important, he says, because if we don't find them and they don't get isolated, that's when transmission would occur. Currently, there are 99 licensed testing laboratories in the country. Harleen, meanwhile, Undersecretary Leopoldo Vega insists that rapid testing should not be used to diagnose and screen people, nor should it be used as a basis if an individual is COVID-19 positive. Undersecretary Vega emphasized, Harleen, the results of rapid antibody testing can't be used as return-to-work clearance of employees and clearance of LSIs to return to provinces. Here is Undersecretary Leopoldo Vega.
Test would have its own function in terms of how you use it. Because if you use this as a screening method on a standalone, it will have many false negatives and false positives. So in other words, that can never test the time in terms of screening. It has to work with the RT-PCR, but the main function or the main usage of the rapid test is actually a prevalence of the immunity in a community. Kung ilan na ngayon yan ang may antibodies for COVID-19.
Arlene?
Aiko, let's just clarify. Is it true that with the upsurge of cases in the Philippines, we are the next potential COVID-19 epicenter?
Arlene, it is not proven yet that we will be the next potential COVID-19 epicenter, since like what testing czar Vince Dizon explained earlier, that the upsurge of cases is not a basis or a concrete basis that we will be the next potential epicenter, because there are a lot of factors to be considered why there is an upsurge of cases in the Philippines.
So, Aiko, after the MECQ status, what's the health department's recommendation on the use of rapid antibody test kits or rapid testing?
The other day, Harleen, the Department of Health presented things that the public should expect after 40 days of the modified enhanced community quarantine. And one is that rapid antibody test kits will no longer be used. And they don't recommend using RATs or RATKs because it is not a basis for an employee to return to work as a clearance, and it cannot be used as a basis for an LSI to be cleared and be brought back to their province. We should always remember, as the health department says, that our rapid antibody testing are not standalone tests, and RT-PCR test kits or testings are still used for them to be confirmed, for the results of the rapid antibody testing results to be confirmed.
All right, thank you so much, Aiko Miguel, for that report.
The Bayanihan to Recover as One Act, or Bayanihan 2, passes on the second reading in the House of Representatives. But some lawmakers are not content with the amount of allocated budget for the proposed legislation. One of our senior correspondents, Ray Pelayo, explains why.
The Bayanihan to Recover as One bill, as it passed the second reading in the lower house of Congress, is packed with a 162 billion peso budget allocation. For health matters, a total of 27.5 billion pesos is allocated for an expanded COVID-19 testing program, personal protective equipment, hiring of additional health workers and their benefits, establishing of quarantine and isolation facilities nationwide. 20 billion pesos is allocated for Cash for Work program, a 51 billion peso fund infusion for government financial institutions, 20 billion pesos for the Department of Agriculture's loan and plant program, 10 billion pesos for the transport sector, 10.1 billion pesos for tourism, 7.9 billion pesos for education, and 1 billion pesos for technical education and skills development authority or TESDA scholars, 12 billion pesos for the subsidies of the Department of Social Welfare and Development, a 1.5 billion peso assistance for local government units, and other funds are allotted for athletes and Department of Foreign Affairs programs.
The House will try to be more brotherly, more fatherly in dealing with this crisis in the next few months.
However, some lawmakers are not content with the amount of the budget.
Baka mahiwalay dito yung talagang, halimbawa yung mga driver, yung mga teachers, kasi hindi naman talaga specific dito yung sinasabing mga subsidiya.
Ang total po na pondo para sa education ay nasa 8.9 billion lamang. At yan po ay talagang hindi sapat, napakaliit na kumpara dun sa pangangailangan ngayon para sa mga bagong modality.
Despite this, various political parties are united in passing the bill. Ray Pelayo, UNTV News and Rescue. We serve the people, we give glory to God.
The Duterte administration expects Bayanihan 2 against COVID-19 to be passed by Congress next week. In the Senate, the version has been passed on the third and final reading with a 140 billion peso stimulus package intended for socio-economic and health interventions. While in the House of Representatives, the Bayanihan We Recover as One bill has been approved on the second reading, like what Ray Pelayo reported, with standby funds amounting to 162 billion pesos.
We look forward to finally passing the bill, hopefully by next week.
The Department of Education has no plans to postpone the class reopening on August 24, 2020, despite objections from several groups. Dante Amento will tell us why.
Department of Education Undersecretary Tunisito Umali believes they are now 90% ready for the school reopening on August 24 or 18 days from now. As of now, there are no changes announced regarding the scheduled beginning of classes. That is unless DepEd Secretary Leonor Briones recommends adjustments and President Rodrigo Duterte approves them. Undersecretary Umali adds, the Law or Republic Act 7797 states that a school year in the Philippines shall begin in the first week of June but not later than the last week of August. Besides, they have been preparing for the school reopening, like printed modules to be distributed among incoming students. Seminars and trainings for teachers continue. Orientations on the learning modalities are also being done for both parents and students.
Ang inyong pong kagawaran ng edukasyon ay naghanda at patuloy pong naghahanda para maging maayos po itong ating August 24 school opening.
But the Alliance of Concerned Teachers or ACT Teachers strongly oppose what they describe as an untimely opening of classes. ACT Teachers Party List Representative Franz Castro explains that the threat of COVID-19 remains high.
Maraming mga parents tayo na talagang worried sa kasalukuyang sitwasyon ng health bukod pa doon sa kalagayan ng pang-ekonomiko.
The group believes that DepEd should revisit its action plan and postpone the class reopening.
Kaya kung ang mga health workers natin, di ba, ay nanawagan ng time out para i-revisit yung aksyon ng pamahalaan sa usapin ng kalusugan, ay tayo rin bilang mga guro ay nananawagan din na i-revisit din yung plano ng Department of Education ngayong balik eskwela.
Undersecretary Umali, on the other hand, stands firm that DepEd is doing all necessary measures to protect the teachers and the students. The education official stresses there will be no face-to-face classes, especially in the first quarter of school year 2020-2021.
What we're trying to emphasize is we are doing distance learning, and that should address the basic concerns on the safety of our learners. Kasi nga po, hindi naman po sila physical na papasok.
DepEd has also released guidelines and memos to its regional offices for the alternative work arrangement to protect Department of Education personnel. Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
Meanwhile, World Health Organization experts say they are seeing in-clustering of COVID-19 cases in countries that have had success in suppressing coronavirus transmission but are opening up. According to Dr. Maria Van Kerkhove, the consistent picture they are seeing is that the killer virus is transmitted in clusters and where younger adults are gathered.
This virus likes people that come together, and it forms clusters and it forms outbreaks. The virus needs people to transmit.
The WHO warns that the virus grabs the opportunity to spread in social settings and gatherings like in bars, nightclubs, and in sporting events, or even before a sporting event takes place.
So we want people to get back to their lives. We want people to enjoy life again, but we do need people to still do physical distancing. It is really important that we don't give this virus an opportunity, and unfortunately we are seeing these clustering that is happening.
WHO experts reiterate the importance of making good decisions and asking ourselves the questions, do I really need to go to a party? Do I really need to be more part of an indoor activity? And what are the consequences of my movement or action? And let's now take a closer look at the updated count of coronavirus cases around the world. The COVID-19 pandemic has now reached a total of more than 18.8 million confirmed cases in 188 countries, regions, and sovereignty. That's after more than 206,000 new cases were reported in various countries from yesterday. Global death toll surpasses 707,000 across the globe. More than 5,000 COVID-19 patients died from the disease in the last 24 hours, while more than 11.3 million patients across the globe have recovered from the new coronavirus infection. Thanks be to God.
Meanwhile, the country's Department of Health says that 3,561 new cases were reported today, based on the total tests done by 89 out of 98 current operational labs. That raises the cumulative confirmed cases of coronavirus infection in the Philippines to 119,460. The National Capital Region reported the most new cases with more than 2,000, followed by Laguna and Cebu provinces, both with over 200 new cases. There are 50,473 active cases of SARS-CoV-2 infection today. Of those patients, 90.9% are in mild condition. The total number of individuals tested for COVID-19 in the Philippines is more than 1.54 million. We have lost 28 more patients, bringing the death toll in the country to 2,150. But through our fervent prayers, medical interventions, and sacrifices of our medical frontliners, 569 more people have won their battle against the invisible enemy. That brings the total recoveries nationwide to almost 67,000. Thanks be to God.
The Philippine economy shrank during the second quarter of 2020, and that's the lowest since 1981. Rosa Licos tells us why.
Sustained strict community quarantine measures to battle the COVID-19 pandemic have caused the Philippines to fall into an economic recession after a significant decline in economic activities for 2 consecutive quarters this year. The island of Luzon, where Metro Manila and Region 4A are located and which have been placed under lockdowns, accounts for 2/3 of the Philippine economy. From negative 0.7% during the first quarter of 2020, the economy contracted to negative 16.5% from April to June, according to Philippine Statistics Authority or PSA. This is the lowest in 39 years' time.
Given the drop of 16.5 for the quarter, we can compare back to the first quarter of 1981. As I mentioned, this is the lowest, the biggest drop, in other words.
The 2-decade economic growth of the country has been hampered by the health crisis, hounding not only the Philippines but the world. The Philippines is one of the countries greatly affected by the pandemic in the Southeast Asian region, now with cumulative COVID-19 cases nearing 120,000. Almost all sectors of the economy, such as manufacturing, construction, transportation, and storage, have experienced negative growth. But some other sectors, agriculture, forestry, fishery, communication, and information services, have seen growth. Meanwhile, according to National Economic Development Authority, the lockdown measures have been implemented together with income support and wage subsidy program to save thousands of lives against the deadly virus. The economy is still expected to recover by next year.
Our Build program, our Bayanihan 2, which we hope to get passed soon, and our upcoming 2021 budget are the instruments to ensure that we recover as soon as possible.
Rosa Licos, UNTV News and Rescue. We serve the people, we give glory to God.
The House leadership says that what we need is not a street type of investigators, but financial forensic experts in investigating alleged corruption, not only in PhilHealth, but also in other government agencies. Ray Pelayo will tell us why.
I'm a little bit concerned that if it can happen to PhilHealth, what about the other government financial institutions na alam natin billion, tens, hundreds of billions ang pera, no? So we have to have an effective watchdog.
House Speaker Alan Peter Cayetano sees the need to tap financial forensic experts in probes into corruption not only within the Philippine Health Insurance Corporation or PhilHealth but also in other government agencies. Cayetano also expressed willingness to allocate budget for the Commission on Audit and the Philippine AntiCorruption Commission or PACC for those experts.
Dahil pagdating sa paper trail na at sa white collar na type of crimes, what we need is not the street type of investigators, pero yung mga forensic, financial forensic, no?
But members of the Makabayan Bloc say that efforts in hiring experts will just be pointless if officials accused of corruption would not be charged.
Kahit na sino pang mga eksperto dyan, no? Napatunayan naman natin yan, nire-recycle lang yung mga opisyal.
Walang need para sa mga experts na ganito kung ginagawa talaga ng pamahalaan ang trabaho niya.
On the other hand, economist and lawmaker Representative Estela Quimbo of Marikina City supports the hiring of financial experts who would reveal the pattern of fraud through financial records. She adds that this move would facilitate investigation and evidence gathering in a systematic way. Ray Pilayo, UNTV News and Rescue. We serve the people, we give glory to God.
The Presidential Anti-Corruption Commission, or PACC, is set to file charges against 36 PhilHealth officials before the Office of the Ombudsman next week. PACC Commissioner Greco Belhica says administrative charges will be filed against the 36 officials, while 13 of them may face criminal complaints.
Iba po na wala sa aming jurisdiction, ipapasa na po namin sa Ombudsman by next week. Those cases na we believe are airtight cases na, mga na-imbestigahan na namin. Definitely po, madadagdagan po yan as the investigation proceeds.
According to Belhica, it is the weak information technology or IT system of the agency that enables its officials to conduct fraudulent claims, especially at the regional level. They also found out the overpriced purchases of IT equipment, even though they are still using outdated ones.
So every region na nagtatransact ang mga ospital in different places, doon nagkakaroon ng areglo, doon nagkakaroon ng kunayban. So ang bank ng pera ng PhilHealth na nawawala, doon lumalabas. Hindi isang malaking mafia yan. Ang meron dyan, isang sistema na ginagamit ng lahat ng mga tiwali doon. Din nga po yung claims na does not have validation features. So pagka lumabas na yung pera, nabigay na nila sa kukontraba nila, makakahati na sila doon.
The commission is looking at an estimated 154 billion pesos worth of losses in PhilHealth since 2013 due to fraudulent claims. The PACC is among the agencies that will be part of the task force proposed by Senator Christopher Bongo to President Duterte that will lead in the investigation on the issues of corruption hounding the agency. The senator says this will be led by the Department of Justice with the help of the Office of the Ombudsman, Commission on Audit, and the Office of the Executive Secretary. Meanwhile, PhilHealth denies the allegations made by resigned anti-fraud legal officer attorney Thorson Keith during the Senate hearing last Tuesday that the agency's executive committee, who are allegedly part of the so-called mafia inside the PhilHealth, have pocketed 15 billion pesos. In a statement, PhilHealth says Keith's claims are malicious that were obviously made to malign the agency's officers who allegedly rejected his applications in higher offices. The agency also denied the alleged irregularities in the interim reimbursement mechanism or IRM of PhilHealth, noting that the releases followed existing guidelines. In a virtual briefing today, PhilHealth Senior Vice President Rodolfo Del Rosario said they will file a libel complaint against Keith. Senator Panfilo Lacson said they will ask Keith to present evidence to prove his allegations in the next Senate hearing next week.
The national government launches a COVID-19 command center in Makati City. Joanne Nano tells us why.
To accommodate the increasing number of COVID-19 patients and to ease the load in overwhelmed hospitals in Metro Manila, the National Task Force Against COVID-19 launches the One Hospital Command Center, also known as the COVID-19 Command Center, located at the headquarters of the Metropolitan Manila Development Authority or MMDA in Guadalupe, Makati City. One Hospital Command Center features real-time data reporting on hospital capacity. Staff here will assist in the coordination of the referral and transfer of COVID-19 patients. Even the number of patients in isolation facilities can be monitored through the command center. This will also help the government in responding to the need to expand the bed capacity of healthcare facilities.
For the One Hospital Command, what we are trying to put here is a very coordinated care in terms of transfers and referrals and medical direction. I think all of the hospital directors would agree that it is much better to transfer moderate and severe cases rather than have them queue in the emergency room where the mortality is very high. We are also here for the strengthening the capacity.
The COVID-19 Command Center is open 24/7. Call center agents will answer queries, coordinate and instruct the caller to which hospital they should go. Hospitals, isolation facilities, or anyone who needs assistance for COVID-19 related concerns may call the Command Center hotlines. A mobile application called Pure for Citizen can be downloaded from Google Play Store or App Store to reach out to the command center. Yusek Vega orders hospital directors to inform the government the actual status of their hospital capacity in order for authorities to address any issues.
We would like to make it enforce the compliance of all hospitals in terms of making sure that they would have to submit the data collect and bed tracker to our national database so that we will have a good picture and details of where the problem is.
Meanwhile, the National Task Force Against COVID-19 will assign East Avenue Medical Center and Quirino Memorial Medical Center in Quezon City as dedicated COVID-19 treatment hospitals beginning August 17. The government will allot additional 500 hospital beds in the two hospitals. The government is also set to open additional Vigilas 1 centers in Metro Manila, Calabarzon, and in Central Luzon within this month with a 3,000 bed capacity. Joanano, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, more than 150 government offices are now on lockdown, while the Civil Service Commission reminds department heads to make sure concrete internal protocols for COVID-19 are in place. Vincent Arboleda will tell us why.
Commissioner Eileen Lizada of the Civil Service Commission believes that agency and department heads must have their own internal protocols in accordance with the DOH guidelines on dealing with COVID-19 cases to ensure the welfare not just of government employees but also of the public. Lizada stressed ensuring such protocols is important in order to stop the spread of COVID-19 in workplaces.
What is your internal protocol as regards nag-swab kayo, may positive, anong gagawin, paano kayo magsasanitize, doon ho muna ba sa may clustering ng positive, paano ho yung mga walang positive, papapasukin ba natin? So we need to see, dapat meron ho kayong ganong internal protocol para ho na everyone is guided accordingly.
As of August 5, there are 153 government offices on lockdown after several employees tested positive for COVID-19. During the lockdown, disinfection and decontamination of the offices will take place. The main Office of Government Service Insurance System or GSIS in Pasay City is one of the government offices on lockdown, while the GSIS branch in Quezon City will remain closed until tomorrow. Despite the temporary lockdown, GSIS clients may continue to process loans, claims, and annual pensioners' information revalidation online through the GSIS website. The COMELEC main office at Intramuros, Manila, and the offices of the regional election directors of the NCR, Region 4A, and Region 4B will remain closed until August 16 to give way to extensive disinfection and decontamination. The issuance of local and overseas voters' certificate at the main office is temporarily suspended. Other government offices on lockdown are the National Printing Office, Presidential Communications Operations Office or PCOO, and the Radio Television Malacanang or RTVM, due to the high number of employees who have tested positive for the dreaded disease. Meanwhile, the number of government employees who got infected with SARS-CoV-2 has reached 10,344 as of the August 5 CSC data. Commissioner Lizada says free medical services are provided to employees if they allow the government to bring them to government facilities and hospitals. Lizada also mentioned that these employees, whether regular or on job orders, should continue to receive their salaries.
Although there is no employer-employee relationship, I personally believe that the agencies must continue paying the salaries of the JOs and COS kasi hindi naman ho nila kasalanan na nag-no-work sila, na voluntaryong ginawa nila. Hindi ho eh. They were forced to not work because of this virus.
Vincent Arboleda, UNTV, News and Rescue. We serve the people. We give glory to God.
A lawmaker constructs free bike repair stations in Quezon City amid the limited transportation. Bike riders express gratitude and relief from the bike repair stations. Let's find out why from Asher Cadapan Jr.
The Metropolitan Manila Development Authority, or MMDA, has recorded an increasing number of bicycle riders in Metro Manila, reaching about 10,000. According to MMDA EDSA Traffic Czar Edison Bong Nebrija, the influx of cyclists began upon the implementation of modified enhanced community quarantine when there was limited transportation.
Actually, on EDSA alone, there's one day na volume count namin is 4,900, almost 5,000.
Different sectors find ways to ensure the safety of commuters using bicycles through their collaborative efforts. Bike advocate Quezon City 3rd District Representative Alan Benedict Reyes takes an initiative by providing free public bike repair stations across his jurisdiction. Every station has a tire air pump, screwdrivers, Allen wrench, vice grip, and adjustable range good for basic repairs.
Marami ng users. So, what next? Dapat may place where a biker could go para kung sakali may magka-problema o magka-aberya, they can go and have it mapaayos. Aside from that, syempre yung safety ng biker as they leave their home.
About 13 public bike repair stations are now operational, strategically located along Quezon City roads. These include bike repair stations in Katipunan Avenue, Aurora Boulevard corner F. Castillo, and C5 Libis. The others can be found along Commonwealth Avenue, EDSA corner Camias Road, Anona Street, Araneta Center in Cubao, and P. Tuazon Avenue corner 20th Avenue. Riders are grateful for the relief the facilities provide because mechanical issues on bicycles are inevitable.
Maganda matulong ng mga kapadyak namin na katulad ng mga ganyan, no. Alam yung mga marami dito, may nakikita ko tuwing duty ko, may mga napaplatan. Kawawa sila kasi hindi na sila makapasok sa trabaho pagka ganun eh.
Napakaganda ng nito, mga gamit, matitibay talaga lahat mapapakinabangan mo. Tsaka salamat sa nakaisip nito. Thank you sa'yo, thank you.
Authorities remind the bike community to take extra precautions when driving their bicycles to prevent road mishaps and COVID-19 transmission and consider the weather too. Asher Cadapan Jr., UNTV News and Rescue. We serve the people. We give glory to God.
Now, here's a glimpse of what's the weather like in parts of the country. Brace yourselves, motorists, and even those staying at home, because the trough of a low-pressure area is affecting parts of the country. State Weather Bureau Pagasa says as of 3 p.m. today, the LPA was spotted 530 kilometers east of Virac, Catanduanes. The trough of the LPA will bring cloudy skies with scattered rain showers and thunderstorms over Metro Manila, Calabarzon, Bicol region, Central and Eastern Visayas, Mindanao, and the provinces of Aurora, Nueva Ecija, and Bulacan. Meanwhile, the southwest monsoon will cause cloudy skies with scattered rain showers and thunderstorms in Mimaropa and western Visayas, while the rest of Luzon will experience partly cloudy to cloudy skies with isolated rain showers due to localized thunderstorms. Take extra precautions because possible flash floods or landslides may occur during severe thunderstorms thunderstorms. We may be experiencing rains, but we are not expecting any tropical cyclone soon.
A top executive in the embattled Philippine Health Insurance Corporation, or PhilHealth, has resigned from his post. PhilHealth Senior Vice President for Operation, retired Brigadier General Agustus de Villa, who was among the officials who attended the Senate hearing on Tuesday, has tendered his resignation effective immediately. De Villa did not cite specific reasons for stepping down, but said that PhilHealth President and CEO Ricardo Morales knows fully well the reason. In a virtual press briefing today, Morales confirms the official's resignation, saying that De Villa wanted to spend more time with his family. De Villa, in his letter, assured that he will make himself available for the ongoing investigations of both houses of Congress. Senate President Vicente Soto III, for his part, says De Villa must have a very good reason for resigning amid the controversy.
And for the news abroad, here's Jovic Burmas live from London, United Kingdom. Jovic, what have you got for us this evening?
William, the UK economy faces a less severe downturn than feared. I will also tell you why France now has the third highest death toll in Europe, behind the UK and Italy, and why several port officials in Beirut, Lebanon, where a massive explosion took place on Tuesday, are now under house arrest.
Go ahead, Jovic. Please tell us why.
Here's a bit of a difficult news. The UK economy here in the United Kingdom faces a less severe downturn than feared. That's according to the Bank of England. According to initial estimates, the UK economy would contract by 14% this year. But now, in its first official forecasts since the pandemic hit, the Bank of England expects the economy to shrink by 9.5%. While the new forecast is said to be less severe, still this would be the biggest annual decline in 100 years. Meanwhile, unemployment in the UK is expected to peak at 7.5% at the end of the year, as support schemes by the government come to an end. France now has the third highest death toll in Europe, behind the UK and Italy. According to European Center for Disease Prevention and Control data, France has 30,296 death cases caused by SARS-CoV-2 infection as of August 5th. That's a few thousand behind the death tolls in the UK and Italy. Also on Wednesday, France recorded its highest number of daily coronavirus infections in more than 2 months. Figures released showed 1,695 new cases within 24 hours. France is not the only European country to witness a resurgence in cases since lockdown measures were relaxed. Let's now take a closer look at the updated count of coronavirus cases in countries worst hit by the pandemic. The United States of America still tops, now with more than 4.8 million confirmed cases of coronavirus disease 2019, but with more than 1.5 million recoveries. Brazil is second with close to 2.9 million cases, but with more than 2.1 million patients recovered. India, the country with the third most caseload, nears 2 million. As the World Health Organization said earlier, India has increased its testing efforts, but the global agency continues to tell people that not only the wearing of masks must be done to avoid contracting the disease. Physical distancing, hand hygiene, proper respiratory etiquette, and being aware of the COVID-19 situation in our areas, all of those are tools to combat the invisible enemy, and most importantly, our prayers. Meanwhile, in Italy, Ryanair flights to the European nation may be suspended after repeated violations of the COVID-19 health regulations. That's according to the Italian Civil Aviation Authority. The ANAC said on Wednesday that Ryanair systematically does not comply with the Italian government's coronavirus rules. Not only is the obligation to distance passengers not respected, but the conditions for making an exception to the rule are also being ignored, the ANAC said in a statement. If Ryanair continued to break the rules, the ANAC would suspend all air transport activities at national airports, requiring the carrier to reroute all passengers already in possession of tickets. But Ryanair rejected the accusations as factually inaccurate and defended its practices, which it argued are compliant with COVID-19 regulations. And those are the reasons behind the news here in the United Kingdom and in other parts of the globe. But William, I will be back to tell you why Britons enjoy 50% discount on meals across the country after Diego and Harleen bring today's sports update.
Okay, thank you very much, Jovic Burmas, and you stay safe there in the United Kingdom.
The NBA Board of Governors announces it will contribute $300 million in initial funding to establish the first ever NBA Foundation. This foundation will be dedicated to creating greater economic empowerment in the Black community. The foundation is being launched in partnership with the National Basketball Players Association, or NBPA. Through this initiative, over the next 10 years, the 30 NBA team owners will collectively contribute $30 million annually to establish the new league-wide charitable foundation. According to NBA Board of Governors Chairman and Toronto Raptors Governor Larry Tenenbaum, they are committed to supporting and empowering young Black men and women in each of the team markets as well as communities across the U.S. and Canada. While for NBPA President Chris Paul, the creation of this foundation is an important step in developing more opportunities for the Black community.
We know that many people would already love to enjoy watching their favorite sports and favorite players live and in person. But the World Health Organization says when huge sports event could resume is still a question. Dr. Michael Ryan said on a Q&A event on Wednesday, the executive director of WHO's Health Emergencies Program, who is a fan of the Leeds United Football Club himself, a gathering of thousands of spectators could be a disaster.
We have to be very prudent. I mean, it's really tough to say we don't know, but the fact is we don't know. Large crowds of 40, 50, 60,000 people is not just the risk of being in the stadium, it's the risk of going to the stadium, the public transport, the bars and the clubs. Imagine all the problems we have now with nightclubs and bars, and you squeeze all that together into a 4 or 5 hour experience where thousands of people go on the same public transport to a venue, get involved in the social aspects before a game, be involved in the game, and then all of the social aspects after. In the context of community transmission, that could be disastrous.
Dr. Ryan underscored that we just have to accept that we move step by step in reopening huge sporting events.
Well, here's something that Britons are enjoying. UK restaurants, bars and cafes saw a significant increase in customer arrivals as diners enjoy a 50% discount on their meals from Monday. This comes after the British government introduced the Eat Out to Help Out scheme. This aims to help the hospitality industry get back on its feet. The hospitality industry is one of the UK's biggest employers, where 80% of the venues closed in April and 1.4 million hospitality workers have been placed on furlough due to the lockdown measures. As of today, over 70,000 business establishments across the country have participated in this promotion that will run until August 31st. The 50% discount, which can be accessed from Mondays until Wednesdays, applies only on food and non-alcoholic drinks customers intend to consume within the business premises. Take note that takeaways are not included. Each diner is allowed up to 10 pounds or $13 off on their bills, and that is automatically applied at the till, with no voucher needed and no minimum spend. Participating eateries will be able to claim the money back from the government within 5 working days. Diners can use an online search tool or download the Eat Out to Help Out smartphone app to search which local venues and big fast food chains are taking part in the scheme. Meanwhile, the discount promotion launched at the same time with the UK government's healthy eating plan that bans buy one get one free deals on unhealthy food has received criticisms from anti-obesity campaigners, saying it would be a green light to promote junk food. Health and Social Care Minister Helen Whately, however, told LBC Radio that under the healthy eating plans, big chain restaurants need to publish the calorie breakdowns of their meals to help diners make an informed choice.
And those are the reasons behind the news, August 6, 2020. I am Herlene Delgado. We serve the people. We give glory to God.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
And I am William Teo. Because we need to know, we will always ask why. Have a great evening and stay safe, everyone.